Hey y'all, welcome to Vetted and Vet Med, the podcast where two African American female veterinarians pull back the curtain on the life and the world of veterinary medicine. I'm Dr. Wilson.
And I'm Dr. Levy. Join us as we dive into real conversations about mental health, career transitions, work-life balance, and the unique experiences we face as Black women in veterinary medicine.
So go ahead, grab your stethoscope,
and get your favorite cup of coffee or wine, and let's get vetted and vet med. Hi, I'm Davita Levy. I am a veterinarian here in the greater Houston area, born and raised in Houston, Texas. I'm a wife and a mom of 3 little kids, and I'm working here in the Richmond, Texas, greater Houston area. I have my co-host here, Dr. Ayanna Wilson. I'll let her introduce herself.
Hi guys, I am Dr. Wilson, Ayanna Wilson, and I am a wife, a mother. I am in the Jackson, Mississippi area, the greater Jackson, Mississippi, and working in this area and beyond, in this rural areas as well. Yeah, and I am here with Miss Davita,
And so we've come together. We both graduated from Tuskegee University College of Veterinary Medicine in Tuskegee, Alabama. TU, you
you
know.
know.
And, Ayana and I, initially when Ayana was getting her master's and she was in one of my classes, and then we also, got to know each other through a mutual friend of
So
ours.
Casey.
Shout out to Dr. Casey, not Clemens anymore at Beckford, who's also one of my closest friends, and like a sister to me. So, and then, through the years, I graduated in 2014. And, Ayana and I, we just pretty much linked back up through a Facebook post. We're both just kind of in this transitional phase in our careers, feeling burnt out, ready for the next stage in life. And she posted something in regards to, leaving her practice and her corporate medicine practice, and she is now venturing off on her own. And I related to that message so well. She mentioned also about starting a podcast. Yeah. And I've been wanting to start a podcast for so many years now. I journaled back in 2019 about starting a podcast, and it never happened.
Listen, I hear you, because I also wanted to start one with one best friend that I have and then another friend that I have, and it just never jump started. This is full circle. We're going to take it as that, and we are going to relish in this moment that we are creating something wonderful for the people, for the culture.
For the culture.
For the community, and we got out the chat and we making it happen. That's all. Yeah.
So I'm loving this. I love that we got out the chat. We are assassinating the procrastination. Okay. When I first talked about starting a podcast, my husband went and supported me fully. Got the microphone, got the spotlight, and nothing ever happened from that.
Same.
So I'm excited about this. We are here 10 years out. Ayana is also approaching 10 years being out as well.
Don't be trying to age us.
It's crazy. Because I feel like I still look the same, and you still look the same. Like, we are aging like fine wine, aging gracefully, and people are still asking, where's the vet?
You look so young. I said, girl, I'll take it. Give it all to me.
Yes.
I'll take all of it.
Exactly. And I'm like, I am the vet. So And so, through our journey along this long road and realizing that we do still actually want to continue practicing veterinary medicine, but also wanting to share our journey is how Vetted and Vet Med came about. And so this is very informal, and it is from two Black female veterinarians sharing our experience and also where we currently are and where we're headed. So we're excited to start this podcast. And at this time, we'll go ahead and share our individual experiences, how we started, and how we got to where we are now. So for me, I grew up in Third Ward, Houston, Texas, one of the many hoods in Houston. And I absolutely love my neighborhood, love my community. And at that time, we did not take our pets to the vet at all, unless they were dying. And so, even all of the preventative care that I am very passionate about now just was not a thing for us. The education that I'm passionate about sharing with my clients, it just was not a thing. And it doesn't help that my parents are not from this country. And so they definitely
A vet?
My
What?
parents are from Trinidad, and let me tell you, there was no, now things are better, but there was no taking the pet to the vet. And like I said, unless they were dying. I think it was maybe in sixth grade. I knew from early on that I wanted to be a veterinarian, maybe as early as like kindergarten, but it wasn't until sixth grade when we had to put together a presentation for what we wanted to be. And so I was able to go to our local veterinarian, who was an old white guy, and that was just the norm. I did not see myself, didn't know how much of, you know, like a phenomena that was or would be for me to become one. And so, but he was very nice. He did take the time to answer my questions. I had to interview him and spend time with him for my project. He also was the same vet that we took our dog to when he was really sick. And he was the only one in that area, in that neighborhood. So fast forwarding to, let me say, high school, I went to Michael E. DeBakey High School for Health Professions. So just trying to tailor my life to what I thought I should be doing to become a veterinarian. I'm like, well, it makes sense to go to a health professional school. So during that time, we did have externship opportunities to spend time in the local veterinary clinics, which I did. And then in undergrad, where I went and majored in biology at Texas Southern University, that's where I realized, like, I really need to get myself together. I needed to get more experience in working in clinics, more hands-on animal experience, which I did not have. Granted, I did not have a mentor to really tell me what I should be doing to prepare myself. And so that's why I think even now, mentorship is so important and key, in your development. So I was like, well, if I need to get experience, then maybe I should volunteer at the Humane Society. So I did start doing that. There was a local doggy daycare that I started working at as well. And then eventually I started working at a corporate clinic as a receptionist and then was cross trained to work as a technician. And that's where I found my mentor. I got the shout out to Dr. Huey Beckham. Dr. Beckham is also a Tuskegee graduate as well. And I didn't know it at the time that he was actually my neighbor. He lived, when we moved from the house that I grew up in, it was still in Third Ward, but it was a couple streets over. And he was my neighbor. He was 2 doors down from me. And I did
Look at
not
God.
know it. Look at God.
Won't he do?
That was divine. And to this day, he wrote my recommendation letter. And to this day, I still am in contact with Dr. Beckham. I'm currently relieving at a clinic
Amen.
that he put me on to.
Full circle.
That was another full circle moment. But when I really, was like, okay, I'm getting this experience. Now I need to be applying to vet school. So I'm looking on the website to see all of what I need. I really was passionate about attending a historically Black college university, HBCU. And so I really only wanted to go to Tuskegee. I know there's people that apply to 1,000,001 vet schools because you're trying to increase your chances, which is great.
Yeah.
But I just did not have a desire. I applied to Tuskegee and I applied to LSU, and I only did that.
Yeah.
Only
I
did
can't.
you?
So look, I have to stop you, Davita, because I need the people to know that this is real time. Like, I don't know anything
Yeah.
about your journey. You don't know anything about mine. And I was gonna wait, but I feel like Kanye right now, and I gotta stop because Tuskegee is literally the only college that I applied to, and I almost applied to the LSU, and that was gonna be
Uh-huh.
it. So
Yes.
just so
Yes.
y'all know, this is
Yes.
another divine moment.
Yeah.
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 That's
Y'all
crazy.
know, we realized through just a few phone conversations that we really Ayana could have been my best friend after all these years because we have so much in common. So it's crazy, but it really is. It's divine. God definitely ordained this for sure, and at the right time too.
Yeah, that
Because
part.
I don't know that, yes, I journaled back in 2019 that I wanted to do a podcast, but I don't know if I would have had even, the mindset, the time really, and the availability to do it, even the experience.
Yeah,
I've
that
gained
part.
so much more. Like, I have more stories to tell
Baby,
between
get to the
2019
struggles.
and now.
The struggles.
I wouldn't have had much to talk about then. And now I do. I have a lot to say now. So this was ordained. And so I applied to Tuskegee, and I felt like I only applied to LSU because, it was nearby, and I felt like I just wanted one other option, but like I had no desire to really go there. And they told me no anyway. So like it never even.
Okay, next.
I mean, I put all my eggs in that basket for Tuskegee at that point. So then fast forwarding to vet school. So I got in, did the interview and everything. And I got in, and as far as my focus area, I initially was interested in zoo medicine. And so I was very interested in working with multiple different species. I did not have any prior zoo experience, but that was my desire, the main reason. So it wasn't until a classmate and a very dear friend of mine, Dr. Raphael Malbrew. Shout out to
Okay.
Ralph.
Okay, Ralph.
Everybody getting a shout out. He was the one that put me on to lab animal medicine. And he was so passionate about it. And I just love to see like other people be passionate about things. I didn't know anything about lab animal, but there was the desire to work with the multiple species, which lab animal does provide. But also there was the opportunity to be involved in research, which I had previous research experience, like in a summer externship while I was at TSU. So I was like, okay, well, I can combine the two together in my career choice. So from then on, I pretty much just tailored, once again, everything was tailored towards developing a career and obtaining a career in lab animal medicine. So every summer was at some research facility. So I spent a summer at Stanford, and then I knew I wanted to come back home because I love going to other places, but I am a homebody. I love Houston, even though it's really packed and everybody is moving to Houston, but I'm always ready to come back home. So my family is here, so I knew I wanted to be here. So I just developed those connections in networking and found my other mentor, Dr. Suzanne Craig. So who I still keep in contact with today because I just had to ask her for another letter of recommendation. So
contact. Don't burn no bridges.
don't burn bridges. So when I met her, she was working at MD Anderson Cancer Center, and she was the head of the residency program because you're doing all these externships to eventually have it turn into something.
Yeah.
You're doing all this networking to be able to reach back out to somebody.
Hello, it's
So
me.
I stayed very close to her. Like I went multiple times to visit. And so I spent time with her because I'm like, I know I want to be at MD Anderson Cancer Center. Like that was then my dream. Like I need to be in this residency and I don't have a desire to be in nothing else. So I think I externed there at least 2 times throughout vet school. And when it was then time to graduate, and then you have to apply to whether you're going to do an internship or residency, I only applied to the Gulf Coast Consortium postdoctoral training program. And that one, it no longer exists. However, it was a tri-institutional. It doesn't exist. It's so sad it doesn't exist anymore. But that was the program that I was a part of that it was a tri-institutional program. So it rotated through MD Anderson Cancer Center, Baylor College of Medicine, and then UT Health Science in the medical center. And then we also got to rotate through 2 different non-human primate facilities as well. One in Bastrop, Texas, and then another one that's local, which is more of like importation, exportation of non-human primates. So that program, I only applied to that one. So I don't know that I would necessarily recommend putting all your eggs in one basket, but this is just what I have done. Yeah, I mean, I just knew what I wanted, and I saw myself at these places, and I just was like, I prayed about where I wanted to be, and I was very passionate about where I wanted to be, and there was no other place I wanted to go. So I did, I was accepted. I matched with them, and I was accepted into that program, and I wanted to work at MD Anderson. You just was not going to tell me that I wasn't going to be there. But that did not work out. I interviewed, and I remember sitting in like my little resident area, and when they were interviewing for the position that they had available, I could hear like not necessarily the conversations that were happening in the next room, but I could hear the laughter that was happening because I knew one of the girls that was interviewing for the position that I wanted. I knew her laugh is very distinct. And, I'm like, it's a lot of laughing going on in there.
I laugh like that. Just knock on the door. Like, hey, cut it out.
It's too much laughter in here. So, anyways, what happened was something else that was divine. She got that MD Anderson position, and then that made an available position at her job, which was at Baylor, become available. And so I, of course, interviewed for that position because I really liked Baylor during my rotation. And so I ended up getting that job at Baylor College of Medicine. So we pretty much just kind of switched places.
Yeah.
But so that's been my journey to lab animal medicine. And I was there until 2019, where I was feeling just burnt out. I was dealing with a PI that was a bully. And at the time, I didn't really have the support that I felt like I should have had. And so I left. And I felt, that at that time was one of the hardest decisions that I've ever made because I loved being there. That was my dream job. And, you know, it was hard to even think about wanting to leave and moving on to something else. And so I ended up leaving and I went just and threw myself cold turkey into small animal medicine. So did not
What a change.
have what a change.
What a change.
What a change. I feel like it's just a different set of brain cells that are needed in order to work in small animal, and it's a different set of, it's a different part of my brain that I got to
Yeah.
use when I go into lab animal.
Yeah.
I started at the end of 2019 working in small animal medicine, and I stayed full time for about a year and a half, and that was during COVID. So that was a hard time to
Yeah.
transition into being in a clinic.
Yeah. Because
Because
in theory,
everybody,
it's not the same. It's not the
mm-mm,
same as it. Yeah.
mm-mm,
You
it's
child.
not. And,
What
for
I now
one,
realize.
I had to learn the products because I'm like, what is this? Like, I had to learn what was the commonly used things
Yeah.
for ear infections, skin infections, like all of these things I had to learn just on the go. And then I also ended up experiencing burnout there because everybody and their mama was getting a new dog.
Because you
Everybody
at
got
home and you think that's what you need to do.
That's the best thing to do is to
And
get.
it's
Why don't we get a puppy?
yeah. Yeah.
No.
Let's raise a whole new life. No.
And it
Get
was
a
during
plant.
the time. Yeah, get a plant. Get a plant. Let's start there
Yeah. If you
before
don't
we
kill that, it will
rate.
talk.
Right. And it also was during the time where people were at home with their current dogs and
Mhm.
realizing like we got issues.
Yeah. Like,
And
why she walking like that? Her
right.
bark is hoarse.
She not eating.
Okay.
So yeah, that was crazy. I still a part of me still wanted to do that.
Yeah.
Even if it was maybe 1 or 2 days out the week, I still kind of miss the chaos,
Yeah.
and then it was more so even about the relationships and talking to people that were not researchers because
Yeah.
it's two just totally different type of conversations when you're talking to somebody in research versus like just a regular person.
Yeah.
And I enjoy talking to people. So that then transpired into I did a few things while I was away from lab animals. So I did that. Then I was like, you know what? I enjoy talking to people. I am passionate about palliative care and making sure that the euthanasia experience for a pet is a good experience for the pet and the owner. And so I went off into having my own mobile clinic where I was going into people's homes, which I did enjoy, but that's another conversation for another time because I have to go more in depth about it. But the only reason why I really stopped was because I was pregnant and
Yeah.
it was a difficult pregnancy
I'm
to
gonna
the
let
point
you go. No more Kanye moments, but I'm gonna let you go.
you can cut me off anytime.
Listen, it's the same thing. I was I was big as a house. And I was
Yes.
like, I can't do this by myself right now. I cannot
Mm-mm.
do this. And, you know, second time around, a little older. I had to wrap it up, girl. I had to wrap it up. And I was
I
like,
had to wrap it up.
I had to go back. I had to go
Yeah.
back. So,
Yeah.
yeah, I can expound upon that later, but yeah.
So yes, I mean, granted, I was a mobile veterinarian. However, I was not mobile. I was
Yeah.
immobile in that pregnancy. So I had to. What I thought at the time was just putting a pause on it, and I still have not gone back to it. And during my bed rest time at home, I even got onto doing like telehealth, which it was that's another conversation too. That right there, they know. First of all, it's working for pennies. It's working for pennies.
Crumbs.
And
Mere crumbs. Baby, the
like,
shaving. What?
no,
I
it's
said, oh,
ridiculous.
this is lunch money. Okay.
That is pure lunch money. It is pure lunch money.
A
And
child's lunch money, though.
a child's lunch money for the boys' school. Yes, here you go. The school cafe. And it's no offense because I'm like, I lived it. So
Yeah.
I'm sharing my personal experience. And I mean, I needed to do that in the interim. But when it got too painful to even sit in a chair and I just could only lay in bed, then I stopped that as well. And that was maybe like a week or two prior to having my daughter anyway.
Yeah.
So then from there, I had the opportunity to actually go back to lab animals. So I had started back in 2021 actually. So I was doing the telehealth and I went back to lab animal part time. So I was doing those together. And at that time, leadership had changed in my lab animal position. A lot of the same people that were there as far as like the support that I feel like I needed, they were not there anymore. And it was more on my terms. It was part time. I could do a lot of administrative, like protocol review stuff from home. And then I still would have to go in one day a week to like walk around my facilities and just kind of catch up on what happened throughout the week. So I've been doing that part time now, but it's 4 years now.
Yeah.
So I love the dynamic of that now. And I don't think that would have been possible without COVID because I tried to have remote. I asked before I left, like, can I do something remote? And I was told no. So now, thanks to COVID, I can do some things remotely with Lab Animal. And just to kind of wrap up, my last position for the last 2 years was at a corporate clinic. So I went back to corporate, but it was a different corporate. Knowing what I was getting myself into, but not really, at least I knew I was signing my soul over. I at least knew that part. I told myself that I was okay with signing my soul over, because I was just trying to get through a time period. And if it had been better, I would have went longer. That corporate experience is not the same for everybody.
Yeah.
But my experience was absolutely draining. And I definitely dealt with some depression, some anxiety, which I'm not known to be either of those things. But in this past year, I definitely experienced that. It was diagnosed with that. And I have sought therapy.
Cheers.
Yes. So, and I don't think that veterinary medicine has to be that way, but
No.
it was definitely a numbers thing. It was a quantity thing and not a quality thing. And I
Yeah.
am very adamant and passionate about practicing quality medicine.
Right.
And so when I felt like it was too much for me, then I just turned in my resignation letter and I realized I don't have to be here.
Yeah.
So I left. And so now I'm back to doing relief. I don't think I mentioned that before, that I also dabbled in relief.
Just gotta sprinkle that in somewhere.
I
In the
also
midst
did
of all the
relief. In
madness,
the midst
there
of
was
all the
relief.
madness, there's relief. And to me, relief it really is a relief. That, and also vaccine clinics. I've
Yeah.
done that ever since I've graduated. There's periods of time where I don't do them, but definitely around the holiday times, I'm always picking up vaccine clinic shifts just to get the
Yeah.
extra income. It's more freeing now doing the part-time lab animal and part-time relief. I'm still making the same income that I was making, and I'm like, I could make more if I choose to work more shifts, but it allows me to be more present mentally and physically, not only for myself, but also for my family too. So
Yeah.
that's where I am now.
Okay, girl. I mean, again, I do want people to know I'm hearing this in real time. You're gonna hear
Mhm.
my story in real time. I know I say a lot. I'm pretty much an open book, but
Mhm.
I just think that it's important to share our stories the way that we're experiencing them because
Mhm.
we might not be the only people experiencing them, but there are some emotions and some trials and tribulations that people are actually going through, but they don't recognize that that's what that is. You know what I mean?
Exactly. Exactly.
So, um, as far as like my journey to veterinary medicine, I am very much the cliche of I always knew, I always wanted to be a vet, but there were some things in the midst of my journey that should have deterred me, but I guess it fueled me because I am a Taurus by nature. So you're not
Mhm.
gonna tell me what I'm not gonna do. That's what
Mm-mm.
you're not gonna do.
Mm-mm.
So, so with that, um, I just went, being a little girl. I mean, I probably was like 5 years old, and we always had
Mhm.
animals like you spoke on. They never really went to the vet like that. There were some very distinct, like core memories that I have about certain,
Mhm.
animals that I was like, oh, that's what that was. That was,
Yes.
like, I
Yes.
mean, getting a puppy from Walmart, like, oh, he's not gonna get any bigger than this, and this puppy got humongous. And I can remember him hurting me in the window. Hurt like I could not get out the window, DeVita. Like
Oh
I'm
no.
like he kept circling and I couldn't and he was like I was like, what is going on? Looking back, he's a border collie. Of course.
Yes.
Yeah.
Yes.
Yeah. So
Yes.
it's like stuff like that. I'm just like, okay, now I see what was going on at that moment.
Mhm.
But, needless to say, I continue my journey, high school. I didn't really do a whole lot of. I mean, I did some stuff at the Humane Society and all that
Mhm.
kind of stuff, but it wasn't anything where I knew somebody to reach out to. I didn't.
Yeah.
I don't think I had it in my brain to let me go reach out to this vet clinic or anything like that.
Yeah.
So I never had that type of experience. But I did do the Humane Society, and I saw what things looked on the inside, which I do think is an important part of veterinary medicine because, okay, yeah, shelter medicine, but you need to see the nitty gritty. You need to see
Mhm.
the parts of veterinary medicine that people get to college and are in undergrad about to, move on, and they don't
Mhm.
realize that this is a part of it too. Like there
Yeah.
is poop and pee and
Mhm.
sickly and
Mhm.
not so cute puppies
Not
and
so
kittens
cute.
looking scraggly, coughing and sneezing and all kinds of nastiness. That's what you need to see. Like you need to
Yes.
embrace that part of it too. But high school and all the good things, but I did have the joy of when I got to undergrad, I went to the Tuskegee, Mother
Mhm.
Tuskegee. Um, you know, went there and loved it wholeheartedly. And my aunt, she
Mhm.
lived in Atlanta. And so, hour and a half away, I spent a lot of weekends there as well. And so, she was taking her babies to a corporate clinic in Midtown Atlanta, and I interviewed there on, I think it was like the second year. Yeah. So I was a sophomore at that point. So um, they were doing charter hospitals at that point. So it wasn't owned by the corporation at that time. There was a charter hospital owned by two veterinarians. One actually was from Mississippi. Shout out to Dr. Freshwater, my girl. And Dr. Cargal, who wrote a lot of letters, very, very intelligent. Um, and then there was another vet working there, Dr. Romanique Ricks, also went to Tuskegee. That's my homie, my mentor, my first mentor. And, I just had the greatest experience. After I interviewed, they actually put me on as a nurse. And at that time, it was called an assistant or, nurse assistant or whatever. But I learned a lot of things and I got my hands in, and it was very eye opening to experience something that I wanted to do later on, because as I moved through, I was just like how y'all were already in vet school. I was like, I was supposed to be in their class, but that's not how life works.
That's not.
Yeah, because that procrastination kicked in, and guess who didn't take those tests that you were supposed to take before you got to vet school? This girl. Yeah, so I was like, so what am I going to do now? And then that's when my undergrad advisor told me this was her last year doing anything, and she wanted me to be her last grad student. So that's how I ended up in grad school, where I did, research with goats. She's called the Goat Lady. She wrote this whole book on goats, like she was the reference. And she's like a 4'0" Iranian woman or Iranian woman. And I can remember times when I'm writing my thesis and all this kind of stuff. She told me I would never make it in vet school.
What?
Yeah. Never make it in vet school. You're too, I think she said I was too general. You don't do this enough. And I don't know. I just remember that you'll never make it in vet school part. And I was like, interesting.
Wow.
I mean, in that moment, I don't even know how discouraging that was versus me looking at her like as another woman in this field. And I know, like, my whole advisory board was men and her. And they were very laid back. And they were just like, yeah, sounds great. Looks good. I present my stuff and she's just like, no, 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 do this, do this. I would have thought that she would have supported me a lot more, but that was probably my first lesson in this field. But again, another story for another time. But moving on to after grad school, I applied for vet school. I got in. Hey girl. Hey girl. And I can remember Casey telling me, and it's one of those moments where I was just being myself and not, nobody gonna tell me what my experience, nobody gonna tell me what this. Casey was like, yeah, it's real difficult and this, that, and other. And I'm like, okay, girl, that's fine. And then, moving through, I had a lot of experiences where I was like, oh, okay.
Yes.
A lot of times where I thought I was not going to succeed through there, but we made it. We got through there.
We made it.
But, just looking back, seeing her, I think we were at that subway at Tuskegee and I saw her. She's like, oh, what you doing now? I'm in vet school. Thanks. That was my full circle moment for her. But aside from all of that, I graduated and I went back to Atlanta and I worked in Fayetteville, Georgia for a little while with this corporation that I had been with since 2008. And I know, girl.
I didn't know it was from that far back.
Yeah.
Wow.
It started then. I was doing seasonal on and off. Like those are my experiences as far as veterinary medicine is concerned. And being a baby doctor, going to this $1 million hospital, like the way they pumping stuff out, it was quite the experience. I saw a lot of things they told me I would never see in vet school. Loved all that. But then my coworkers or other doctors started leaving, and then there was me left standing in this $1 million hospital with the same traffic, moving on. And I'm just like,
Yeah.
I can't do this. And nobody tells you, Davita, nobody tells you not to work a 4 or 5 coming out of school. Nobody tells you that.
Mm.
Do not work every day of the week.
Mm-mm.
Don't do it.
Don't do it. No.
Easiest way to burn yourself out.
Yeah. And I
Crazy.
think I think yeah, and right, no, for one, nobody tells you. And I think that we think that that is what is the expectation, like
Yeah.
we're expected to do that because it's
Yeah.
like, okay, that's the work week. But I think that it depends on what your work is,
Yeah.
I mean,
Baby, it ain't saying 30 pets a day every day.
every day.
4 or 5.
No.
You know how that starts to
No.
try to, starts to run it. And then we were open on
Mhm.
Sundays. So it ran into the other
Mhm.
weekend. I was like, wait a minute.
Mhm.
Your
Mhm.
girl has
Mhm.
not been off. I'm not
Right.
off. So, you know, and I
Yeah.
thought I was making a little something too at that moment. And
Yeah.
honey, yes, it was awful. I did not have a good boss in that moment. There were a lot of experiences that I had there that led me to make my decision to depart from the corporation
Mhm.
very easy. I was recently engaged and I was just like,
Mhm.
okay, all this stuff is kind of just aligning to
Yeah.
where it's okay, like we're out. So I moved back to Mississippi, where I can be around my family and be closer to my husband's family. And when we, raise these future children,
Mhm.
we'll
Mhm.
have some, support system. So
Yeah.
um, when I got back, I was working for um, a hospital that was not very far from where we were living, or where I was staying in that moment because we were still looking for a house, whatever.
Mhm.
And we that hospital actually had recently been acquired by another corporation.
Mhm. That's kind of like the beginning, right? The beginning of the current time.
And that's not, and I was like, okay, good. When I first came on, like they sent me these cookies, Davida. Um, do you know, first of all, I'm a cookie monster. They sent these cookies and I was like, I'm sold. I'm sold. Yeah. Where did y'all get these cookies from? I hoarded these cookies to the point where I didn't want nobody else to have them, and they molded
Oh
the rest
my
of the cookies. Yes,
god.
that's how trifling I got. Anywho,
But
I
all
was
it
on
took
the
was some
internet. I was like,
cookies.
what looks like this cookie on the internet? Like, I gotta
Right.
find these cookies. Where did y'all get these cookies from? This is how y'all get people a salary. What's that? Give me these
The
cookies.
cookies.
Pay me in cookies. So I mean, working there
Oh my
was definitely an
goodness.
experience. It wasn't even the corporation at that moment. It was the lead doctor that
Mhm.
led me to dip on out after about 3 months. It was really bad.
Mhm.
Um, and so then I started doing relief, but also trying to dabble in my own house call business. And that became something that I was really passionate about as well. Um, and here and there, like once I, got married and started to grow a belly with a life inside of it
With the
the
light.
first
Yeah.
time, I was like, let me see what the corporation's talking about over here
Yeah.
again. Let me try to get my life together a little bit. Because, let's be honest, like the house calls, you weren't
Yeah.
getting that many clients.
Yeah.
So it's like extra income, but it ain't the income that you need to pay the bills.
Yes.
So
Yes.
with that being said, I took on 2 days a week and then I pick up here and there. And then I gradually
Mhm.
start to get back into this corporation, signed on as a part time employee and then a full time employee. And then a lead doctor, and then I turned to chief of staff. Like I would swear this happened overnight. I never want to be nobody's area chief of staff. How did I
Right.
get bamboozled into this position?
Right.
And I'm saying bamboozled now because looking back on it, if I would have never been in that position, I'd probably still be there. If I would not have seen the sides of things that I saw, I would still be there. But after doing that for 2 years, yeah, last year was a struggle in itself. Just like you mentioned, depression, anxiety, it was boiling over into my home life. And that's when I was like, Also, it affected my health. And I was like, oh no, but
Yeah.
we got to go. And so, although my boss at the time was acting really surprised about my decision to take leave, knowing I wasn't going back, I did it. And I haven't been nothing but happy ever since. And so I'm back into doing my house call business. I do days at the spay and neuter clinic, which bring me joy because I love surgery. Even if it's 25 in a day, something I was not very used to. But okay.
Here we are.
Yeah, but I mean, I love them there. They're really nice. They're really supportive and accommodating, and that has been life thus far. Like I just, I've had my mentors. I've had people try to, deter me from doing things or being negative Nancy's in my life, but
Oh
I
yeah.
am glad that we're here, and this has been nothing but the best experience. I probably would never have done anything different because I wouldn't know what I know now. So
Exactly. Exactly.
yeah,
Yeah. I would say the same. I would not have done anything differently
yeah,
because of the experience. And I think that's the best thing that I can take from each of the opportunities that I've had is the experience. And,
yeah,
I feel like even doing relief, it allows me to, like, you just jumping in there. You don't know these people.
yeah.
You
You're
may
not
have not,
alert.
yeah.
Like
So, and yeah, you're doing a service for them because otherwise they may have had to close that day,
yeah,
but you don't even know the software. Like just being able to like
it's a real
yeah,
life thing.
it's a
Like
real
I was
life
used to a
thing.
very specific software, and I was like, Avamark, what?
Yeah.
What is that?
Yeah. There's Evermark, which I'm like, for each of these, I only know just enough to do what I need to do. Once we start asking about some other things like
Can't help you.
estimates, I cannot help you. So,
Oh.
so even that, like you got to give yourself grace.
Mm,
Just even for one, being open to other opportunities for yourself
yeah,
and, being willing to learn and to grow. And I feel like
right.
even when I go to the different clinics, like learning different treatment protocols for different things because again, I just came out into this side of,
Yeah,
the field and so I'm learning different things that different doctors use, and they may have medications that you don't normally use for the
yeah.
same things. And so you kind of have to work with what you got. And, I feel like we definitely learned that at Tuskegee, just
Listen,
working with what you got and
I had to tell
making
them
it
a
work.
lot of times. Yeah, like, oh, we don't have this. I'm like, okay, we got it.
Okay. Right.
It's fine. But I mean, to piggyback up what you said as far as like, working with what you got and just, it being your experience and learning and growing.
Mm-hmm.
It made me think about when I did leave, but before I left, my homie support system practice manager left before me, and she got
Mm-hmm.
this job, and she was just like, I don't know if this is something that is going to, basically fulfill me. And I'm like, it doesn't have to fulfill you. But in this
Mm-hmm.
moment, it's better than what you are and, your situation is
Yes.
now. So that just has to put you in a mindset. Like everybody listening or just having these conversations, this has to be open to the fact that the next journey, the next part of your journey is not necessarily about fulfillment. It's about moving on and experiencing something new so that you can find what fulfills you at the end of the day. Like
Yes.
that's the most important thing. So
Yes.
you're not at your end all be all the time. It's just the next step.
Exactly.
What's next?
Exactly. And I'm glad you said that because I think that was what I was so like heavily focused on is
Yeah.
fulfillment, being fulfilled, the work-life balance. And, I felt like once I was at my first job that was the end all be all. Like I'm gonna be here and I'm gonna retire here and they're gonna
Hmm.
have to get rid of me. But, but that doesn't, and if that works out to be that way, then great.
Yeah.
It just was not it for me. I mean, there is a vision that I have of what I would like my life to look like. And
Yeah.
so I had to get out of the mindset of feeling stuck,
Yeah.
and that's why I feel like for anybody that is feeling like they're stuck in a situation or a position or at a practice, it's like you don't have to be there. Like
They
if it
need
is,
you.
yeah, they need you. Like,
They need
yeah, you need them. You need the income,
Yeah,
sure,
for sure.
but like you don't it doesn't have to come from there.
Yeah.
There are there's a clinic down the road, and they may be able to provide you what you're looking for, but you do have to be willing to make that first step. And
Absolutely.
there's so many areas, and that's what I do like about veterinary medicine is that there's so many areas that you can work in, whether it is in
Right.
government, in research, pharmaceuticals, in the industry, like in the
Yeah.
small animal clinics, mixed animal, large animal, like whatever it is. And now
Right.
it's just evolving even more to where you can do your own thing.
Yeah.
um, you do have to be willing to take that, and then it does take a shift in your mindset
Mhm.
to like, okay, you can go somewhere else, and
Yeah.
if that place doesn't work out for you either, then you can go somewhere else.
Right.
And and I'm like, I mean, at some point you do have to kind of be like, okay, is it me?
Yeah.
Because
Am I the drama? Baby, am I bringing the noise? Am I the
right.
chaos? Am I the kind
Definitely had to do, some reevaluation of myself. Like, am I the problem? But, you know, I think it's just more so of me just again, like I'm not going to reach, perfection, but being able to just get to that place where I am, at peace. That's important to me now. Being content with what I have and making the best out of, what I have is what I'm
Mhm.
focusing on. Being able to be home at a decent time,
Mm.
to have the
Mm.
energy to
Cook.
cook,
Jesus.
to do homework, the whole bath time routine, have time for myself because I need my own quiet time. And
Yes.
also to be there for my husband, as
Yeah.
well. Like it's all these things, all these, these women that I am encompassing. And it's
Listen,
only one me.
that's it.
So like I don't even think I would not want to, I'm not saying that I don't want to like work. Like I want to work, but I
Yeah.
also don't want to be overwhelmed with work. Like I don't want that
Yeah.
to be my only focus. And so at
Yeah.
this point in my life, I'm like, I need the job to have my income. Also, there are some things that I am passionate about. And so I'm just focusing on those things as far as veterinary medicine is related. But this is not my life. Like, I'm not just this. I'm not just a veterinarian, and there's other.
Yeah.
Like, I've always been adamant about having a social life.
Yeah. Listen, I was traveling before all of this.
Exactly.
I mean, me and Dexter would go to all the places. Bourbon and whiskey was our bread and butter, and we used to be out at all the distilleries, honey. And so it's just, of course, life changed. You have kids and all that kind of stuff, and then it turns into I come home and it's time for basically them to get in tub and go to bed. That ain't the move for me. I need to be able to, because now I feel guilty because they go to sleep and I'm up trying to have my quiet time.
Right.
Now I need time with them.
Yeah.
And then I need my quiet time. There has to be
Mm-hmm.
that type of peace, because you mentioned peace, and that is a word that is not lived in enough. Like, there has to be some kind of peace. I mean, whether I mentioned I'm a Pilates hottie, so I need my Pilates, and I
Oh, I
love
didn't know she did Pilates.
yes, I love Pilates, and it is necessary for my mental health. And even starting the spay and neuter clinic, there were certain days that I like a certain instructor to go to, and I have to be at the clinic in certain days. So I had to compromise with this with the director. I'm just like, hey, I have to do this, but I love being here. So please understand that this is my dilemma, and I hope that you can compromise. And they're like, whatever. I'm like, oh, thank you, Jesus, because
Thank you.
somebody was gonna have to move,
Yeah.
and it wasn't gonna be me. Not this time. Not this time.
Right.
But yeah, I just feel so much more at peace. Um, I'm not having to, take medications and do all the things. That's and that was a big part of it for me too. So, needless to say, yeah, I'm happy is on the horizon. I tell you that.
Yeah. Yeah.
Yeah.
And it's a
So
lifestyle change, it's a
yeah,
lifestyle switch. And I mean, we're in charge of that.
yeah,
You have to take control, because I think that's the other thing too is, as children, people are handling and taking care of everything for you,
hmm
and then you wake up and you realize, like, I'm an adult now.
darn, dang on it.
There
Who
is
did
not,
this?
yes, we are adulted now, and it's ghetto. And we do, like, yeah, it's for the streets, but you have to, I'm like, you're in charge of what you want your life to look like, and I mean, it's not to say that you have full control, but there
Yeah,
are some things that you can do, to help it look like what you want it to look like.
yeah,
So, I mean, for now, that will be my focus
yeah.
until, doing relief and doing lab animal. I had applied to a government position, and it was even last year. My husband was like, "That might not be the move." And I haven't heard. I mean, I heard about me being transferred to, like, the hiring
Yeah,
manager.
it takes forever. The government takes forever to transition through.
And I never heard anything else. And then now, since
Yeah,
then we've had the election, and now I have no idea what's to
trash,
become of that.
trash, trash. I hope they wrap it up soon. Wrap it up. Like, this is all a game. I feel like we're on reality TV right now, and I
Yeah,
love trash TV, but this is
yeah.
ghetto.
This is
This is straight ghetto.
ghetto. So I
Yeah.
don't even
So
know what is to become of that position, but I'm good where I'm
yeah,
currently at. So we shall see. But
yeah. Good talk. Good
mhm.
talk.
So I think this will conclude our introduction, but we'll have newly released episodes coming out every 2 weeks. If we're able to do weekly, that would be great.
Remember, in the beginning, we said wife, mom, vet. We're trying to make it work. So,
we're
we gonna get there.
we're currently in the struggle. Well, I don't want to say struggle, but
No, yeah, we in real
yeah,
time, y'all.
we in
Real
real
time.
time. So the goal is every 2 weeks, but we're happy to be here. If there is anything that you would like to hear from us or see from us, then we'll be happy to share those moments with you. But stay tuned for the next episode.
Yay! So excited.